Knee pain is very common. About 1 in 4 people have knee pain, and there's many different reasons given for knee pain. Sometimes it depends on your age. When you're old, you'll be called osteoarthritis. When you're young, it might be a sports injury or growing pain. It could be called patellofemoral dysfunction. You might find that you have some ligament damage or cruciate damage. It doesn't matter in the sense that you still have to do all the exercise rehab. And one of the things that's very important to do is to settle the pain, prevent aches, and I find that this D-tape helps, which is dynamic tape. It's different from the old-fashioned tape is that it's got a bit of elastic in it. So it means that you can move and do a lot more of the agility exercises. You start by snipping off about 1.5 of the squares there, about 9 centimetres, perhaps slightly more. And then you snip off a little bit of the edges, and that stops it snagging when you're on your clothes. And there we are, ready to go. So the kind of test that you might do to test if the tape is working is you think about what normally hurts your knee. Is it going upstairs, downstairs? Is it twisting? So for example, if it hurts going downstairs, just to benchmark it and see what it feels like, you might try just doing a very slight bend and stop when it hurts. And just benchmark how far you can go down. If I put my arm here, I get down to my wrist and it hurts, and up again. And what you want to do is remember the pain that you felt and how far you went. It might be, another thing is that you might twist and feel the pain through your knee. So if I've got my arms bent to my waist and I twist through to about 45 degrees, I can feel the pain in there. And just remember the feeling and remembering how far you go. If your problem is going upstairs, well, you might have a step handy and just do a step up and down, say 3 times, and feel what it's like, got the pain, and then you benchmark it. Now you put the tape on and we're going to retest. I've drawn a picture here of my patella. It's just a small bone that sits on top of the big bones underneath, and it's held in place by ligaments, but also it's controlled by muscles, and it's muscles that we're trying to encourage to work effectively here. So first of all, I'm going to open the tape up just by tearing it, and see if you tear the backing tape, then it becomes easy to unpeel it like that. And this is very stretchy tape. It's got a lot of give in it. So you sit on the edge of the chair and put the back of your heel on the ground and straighten your leg. So if you've got the weight on the back of your heel, you don't have to then work hard to keep it straight, but it needs to be straight to work. You put the tape on the outside of your kneecap, so a little bit away from my drawing, starting there. Hold it there for a moment, and the heat seals the tape in. So it takes a moment of heat for the tape to really lock in. Then you pull, give that stretch on the elastic tape, pull it over, and you can give a little bit of a push as well, but just the pull should then, you'll see some wrinkles fall. Take the pressure off for the last little bit, because if you take the pressure off, it takes a little bit of pressure off the skin. I'm going to stand up to show you how to do the tape. You always put it on in sitting normally. When you stand up, you just keep the tape leg out straight and bend your other knee to stand up, because it takes a while for it to seal and you don't want to put too much pressure. I've drawn my kneecap in pink on this side, so rip the back of the tape off. You can do it in standing, it just doesn't seem to be as easy for most people. So this time I'm going into the other leg. So this one went in that way, this one's going in that way. So put the tape on the outside of the pink, on the outside of your kneecap, straighten your leg, pull the tape over so you've got that stretch, and then just attach and take a little bit of the pressure off at the last bit so that you don't put too much pressure on the skin. And if you see, it's all wrinkled up now. So that tells me I've got my knee snug. Okay, so I've got my tape on, and I'm just going to go back to the movement that created the problem for me before. So my one that I remembered is twisting through about 30 degrees, and you just want to see if it feels better. And it might not feel like the pain's completely gone, but it might feel more steady, more stable, more secure. Now, if the tape didn't help, you can take it off and start again, or you can put another one over the top, which I'll show you in a moment. just about taking it off, you do have to be careful taking it off that you don't suddenly rip it off, because sometimes people pull it off too suddenly, and if there's any delicate skin, it can actually remove your skin. So you just peel off the corner gently and ease it off like that, and just make sure that it feels comfortable as you go. If it doesn't feel comfortable, if you hit a block or whatever, I use this remove, and it's just from the chemist, and you just put it on, make sure smooth it in underneath the tape, and it loosens it up and helps get you off. Now you have to be careful with tape, is that some of us are allergic to the tape. Not very many. I found that with the K tape or the dynamic tape or the elastic sports tape, I haven't had as many people with allergies as with the rigid old-fashioned sports tape, but it's always a good idea to test it out. Perhaps just to put a small piece on your arm for a couple of hours, make sure that there's no allergies. So if you're a little bit sensitive, I do that before taping it. The other thing to do to avoid a sensitivity is to only wear it for an hour or two to start with every day, just an hour or two when you're doing the things that you think are going to hurt. So if, for example, you're going to be going downstairs and you know the stairs hurt, you make sure you've got the tape on for that. If you're doing your exercises and you're just finding it hard to get any improvement with the exercises, you put the tape on for that. So as I said, it might be for an hour or two a day to start with, just to make sure that you haven't got any sensitivity building up. And when you take the tape off, then you should make sure that all that black elasticy stuff that's left around the edges, that's removed. And again, the remove stuff is good for that. Not that I'm being sponsored, but I don't know any other brands at the moment that work as well for the remove. Sometimes people use baby oil, sometimes people use a little bit of natural oils for removal, but this is the one that I tend to use. I wouldn't use the tape overnight. Just a few occasions where I have used it overnight is for people who really have got that ache at night. Something's really hurting and you need the tape, but I wouldn't do it first time up without lots of trial and testing for an hour or two here or there. Okay, so if your tape didn't feel like it was secure enough, I'm going to get some other tape on. So I've done the test, made no difference. I'm just going to try again, putting the tape on as a close-up. So this one's just pulling over. I'm going to start this one lower by putting it on the outside and giving it a slight uphill pull like that. And you see I'm getting much more wrinkle in there and over. Now that doesn't work for me, but it does work for some people. And again, you try it out, see what works, and if it doesn't, come back and either take it off or try again. Stand up on the other leg, and that makes sure you're not going to pull it off. I'll show you the simplest possible tape, just a small tape pulling your kneecap over. You can certainly try other systems of taping if this one doesn't help. So you just test and retest. The point is that it's meant to make you feel better and it's meant to enable you to do your exercises. If taping doesn't help, or you develop an allergy, or you feel uncomfortable with the tape, just try using a very simple neoprene knee brace from the chemist, and it just one that gives you that nice snug feeling, but obviously not so tight that it constricts circulation. I think that in the long run though, the tape is all it's there to do is to help you develop your strength, agility, flexibility and endurance, because there's no substitute for developing the muscles to do the work, and they will and can develop stability in your knee so that you don't need the tape, you don't need the brace in the long run. And hopefully I'll be putting up some more exercises for knees on YouTube soon.